Host. Hey everyone, and welcome to Chef AJ and Friends. I'm your host, Chef AJ, and today I have three very special guests from Lifestyle Telemedicine. Please welcome them to the show, Anthony Masiello, Dr. Jeffrey Pierce, and Dr. Kim Scheuer. Nice to see all of you. I don't think I've seen you all in one place since a couple of years ago at the Plantrician Conference.
Right. Yeah. We don't get together in person too often. We spend a lot of time on Zoom together.
But I saw you, Anthony, a few weeks ago, or maybe a month ago now, in Las Vegas, which I just returned from yesterday because I went back to see Rich Little.
Oh, yeah. How was that?
Oh my God, he was so funny. I tell people I'm going to go see Rich Little, and the first question is he still alive? And he literally opened the show with, "Well, I'm not dead." So it was really good. I
That's
want
fantastic. No, and I had an amazing time at your plant party in Las Vegas. It was so much fun.
Well, thank you. It's not my party. I'm the host. The gentleman named Benji Kurtz produces it. Maybe you get all the doctors there next time. Have like a little booth.
That
I
would be awesome.
Yeah. Remember Peanuts, the doctor is in, how
Yeah.
Lucy would say that. So let's do that and have all the lifestyle telemedicine because we had Nikki there, Dr. Nikki Davis.
Yeah.
So let's get them all. It's Labor Day next year. I was there also bringing some samples to the chef because the one complaint was, believe it or not, there wasn't enough dessert.
Oh boy.
So I brought some really healthy, date sweetened, low calorie dense options to show them what it could taste like and told
Oh,
them
nice.
to make them and all that kind of stuff. So who have you got with you today, Anthony?
Today we have Dr. Kim Scheuer and Dr. Jeffrey Pierce, and together we're going to talk about testing. We're going to talk about different biomarkers that are worth testing, what to watch for, and how to really make sense of it to understand how they impact both people's lives and their risk factors for disease.
That's great. And we also have some questions that are sent in. And when we say sent in, I have a community called Chef AJ and Friends. And this whole week, you're going to get a taste of what it's kind of like to be in the community because we have very special guests like medical doctors, plant-based doctors that will answer your questions. And this is kind of what it's like. So
Yeah.
you're kind of the man behind the curtain of lifestyle
Yeah.
element, right?
Yes. Yeah. I started the company again, as you know, and other people might not know, it's all started with a pretty big health scare for myself. I gratefully learned how to get healthy with essentially what's known today as lifestyle medicine. But back then it was just called eating healthy, back in 2005. And ever since I reclaimed my health, which included me getting off a bunch of medications, lowering my blood pressure, lowering my cholesterol, losing 160 pounds, all of these things. I've been trying to think about how I can help other people to do the same for themselves. So, fast forward, and in 2020, we launched this telemedicine company to help make sure that people everywhere have access to a doctor who can help them to heal, essentially. And to use the medications very appropriately, but not to rely on medications to be healthy. And that's through things like we all know and love, which is eating a very healthy, whole food, plant based diet, getting good exercise, getting good sleep, taking care of your stress management, all of those factors that come together.
Right.
So,
And are you in every state yet?
yes. Yep. So we have
Nice.
doctors available in all 50 states. We're bringing on a new doctor. We're going to announce him, I think, on Thursday or Friday of this week, but we can give a preview. His name is Dr. Olsthausen. And he's licensed in 46 other states. And he basically means that we are going to have double coverage in almost all states. So now people will not only have access to a doctor, but they'll have a choice of which doctor that they can see, which will really help us to be able to ramp up capacity to help more and more and more people.
That's so great. Where did you think of this great idea? And what took you so long?
I know. Like most things, it came out of kind of necessity for what would I want. I always wished I had access to a doctor who understood whole food plant-based nutrition, and even more importantly, a doctor who understood the health goals I had for myself. Like I didn't want to just be okay. I didn't want to just wait until I needed my next medication or my higher dose of blood pressure medication or my next escalated dose of a statin to manage cholesterol. I wanted a doctor who was going to help me not only to not need these things, but to really feel the best that I can. And and that's what led me to, I'm so fortunate to know so many doctors who care so much about this kind of medicine and want to help patients this way. And I unfortunately knew a lot of sick people, and I knew a lot of sick people who wanted really better kind of care. And essentially what lifestyle telemedicine is, and what my humble role is I provide a place for these people to meet. I don't provide the care. I don't help the patients directly, but I just want to help, to connect doctors with patients everywhere. And I'm so proud to have done that for thousands of patients already. And that includes patients in every single one of the 50 US states, plus Washington, D.C., and 27 other countries around the world. People have had visits with these doctors from everywhere. And yeah, in case you can't tell, I'm a little bit excited about that.
That's great. Now, do you ever foresee a time where insurance will be involved, where people
I,
can?
I hope so. I think what we're doing is we're kind of innovating, and that's on the part of, us as the company, these doctors as incredible physicians, but also the patients. And that's not lost on us. These are patients who are stepping outside of the medical system to provide themselves with better care. And what's going to happen, what needs to happen, is enough people need to do that so that the big health systems and the insurance companies start to pay attention to it. And they say, hey, these people are spending a few dollars out of their pockets, and then they're saving us a whole ton of money. Why don't we help them? Why don't we pay for them to have these kind of medical appointments, so then we can save the money on, from the medications and the other procedures that will come down the road. So I do foresee it. It will happen. It is inevitable. What I don't know is if it takes 5 years, 10 years, 20 years, 50 years, that's going to depend on all of us.
Nice. So how many doctors do you currently have? I know you're going to add another one, you said,
Yeah.
this week. So how
So
many?
right now we have 6 doctors, and we have a seventh who's joining this week.
Nice. So you have 33% of them here today. You want to tell us?
Yes. I'm so lucky to have maybe we can ask Dr. Kim Scheuer to introduce herself and share a little bit, and then we can go on to Dr. Jeff Pierce.
Hi, it's a pleasure to be here. My name is Dr. Kim Scheuer. Dr. Kim Scheuer is hard to say. And I joined originally plant-based telehealth and now lifestyle telemedicine because when I was 47, I realized my mom had breast cancer at 48. And I was like, how do I prevent breast cancer? And discovered lifestyle medicine, healthy eating, moving more, etc. Lost tons of weight, no longer struggling with my weight, which I struggled with from 13 to 47. Feel younger than I did in my 20s, and now have much less risk factor for the breast cancer and actually colon cancer in my family. That's pretty prevalent. So I discovered it for myself, started using it on my patients, saw amazing differences, and then begged Anthony, like, I want to work with you. This is awesome.
That's
That's
fantastic. Do you have a certain specialty within the organization? Like, do certain doctors maybe lean more towards maybe GI or women's health or things like that?
So we have an incredible brain trust of doctors here. So it's great. When you see me, if I don't have the answer, I can talk to each one of my colleagues and say, hey, your expertise is this. Mine, I'm a generalist. I love working with people who have diabetes, cardiovascular disease, hypertension, cholesterol, want to start moving more as they get older. I work with people who have autoimmune issues. So I also do really like working with people who have food addictions because, hi, I'm Kim, I'm a chocoholic. And so I love learning and teaching what I learned, and I love working with my fellow docs because if I'm not an expert in some field, I can ask them and they can all help me out, which is great.
Nice, nice. And I know Dr. Jeffrey Pierce because he is in Santa Rosa.
Hey AJ, it's good to see everybody. It's good to be here on your show. Thank you so much for having us. Yeah, my name is Jeff Pierce, originally from Texas, but have been in California for a long time, Northern California. where the good folks of, well, the McDougall program used to be based out of here, and True North, and all sorts of cool stuff happening in our neck of the woods. And I'm a family medicine doctor by training, and then also lifestyle medicine boarded afterwards. And I have a great job because I get to work with Anthony and Kim and the rest of the people on the team, and to see patients get well, right? I think that's what Dr. McDougall used to say. He said he had the best job on the planet because he would see his patients get well, and he really hit it on the nose there.
Right. Well, speaking of getting well, a lot of people rely on the numbers from their blood tests and they need them demystified. So I want to start out by asking you which blood tests and health markers even matter, or which matter the most and what don't. I mean, there's some really obscure things when you get your blood tested, and vegans are often hyper conscientious and they worry like if it's just like one, like, let's say normal is 10 to 30 and it's 9 and they flip out. So when does
Mhm.
it matter? When doesn't it matter? And what matters most?
Sure. Well, I'll start on this. I think there's definitely varying opinions on um, which are the best labs to get, how often we should get them. Um, and so my point of view is that it is important to know certain lab tests, but it's also not to get bogged down in them and to worry about this value was 1.2 low and this other value was 1.2 high. And because labs are just are one point of the equation, right? And they don't tell the whole story. And there are labs that have good scientific evidence based on lots of studies showing that, yep, all adults should be screened for these things. And then there are lab tests that might be good, but we don't have the evidence. And then there's probably lab tests that are definitely not good, and we should not check them. I would say that as a lifestyle medicine doc and a family doc, we like checking some core important labs, but we are very wary about not checking a panel of 500 labs um, just because it looks fancy. And you think, oh, maybe I'll just uncover something that's explaining why I am fatigued, or that some really important esoteric thing. And I'm afraid that a lot of that is can be distracting from the most important parts. So I would say that probably the labs that have the most evidence and some of the basic things that we check are cholesterol screening. Cholesterol is the most important factor when it comes to heart disease, and heart disease is the number one killer of men and women in the United States. And so knowing what your cholesterol is very important. And most of the data it tracks along the LDL, the bad or the lethal cholesterol, that is. Um, and uh, and so knowing that might be the most important number from the cholesterol panel. You'll get a little bit more from the other components of it, and we can talk more about it in detail. But checking your cholesterol, knowing what that is, and it is one of the most important. Maybe I'll stop there and let Kim talk.
Sure. So I think you're very accurate in saying we really need to take this all in context. What's your health history, your family history, your lifestyle? There are the basic labs that, whether you're vegan or not vegan, or plant-based or on a SAD diet, should be, the cholesterol, the kidney function, liver function, and the chemistries. Um, and it's so interesting because we always focus on the plant-based people. What are they missing? What are they doing? But the people on a standard American diet, who we all know people on them, some in our families, things like that, need to worry about certain things in terms of, heart and et cetera. Like, they should be checking for inflammation with an HSCRP, a uric acid, to make sure that they don't have things like gout, liver functions, because, if they're have fatty liver and kidney function. With the people who are plant-based, if there's fatigue or something like that, I look at, maybe, are you getting enough iodine? because we don't get so much iodine when we're whole food plant-based. Not many of us have iodized salt on in our houses. Ferritin, if you're tired, B12 and D are things to consider, but not blanket. This is why you want to talk to a doctor. And I don't want people scared, AJ. I had a patient recently who came to me who was plant-based, lean, exercises well, lipids were excellent. And her doctor wanted to immediately put her on a statin because her CRP was high. And she came to me, she's so frustrated, she's upset, she's doing everything right. And I said, have you had any surgery or oral surgery recently? And she said, yeah, I've had tons of dental work. And I'm like, oh, well, that can falsely elevate your CRP, which is an inflammatory marker, transiently. So let's get all that dental work done and recheck you, because I'm not as, we may need to put you on a statin if it stays high and things like that. But, you have to have context, which is why when you get labs, see a doctor. Ask the doctor what labs they think is important to you after evaluating you. So you don't spend all this money and give all this blood for no reason. And you have context when something comes back if it's abnormal.
Mm.
Nice. Thank you. Thank you. So,
That's
oh, go ahead.
AJ, I just wanted to comment on that. That's such a good case. I think there is there's the issue of having the ability to order your own labs without a provider, similar to being able to go into a place and get a total body scan just in case there's something going on. And there's a reason why we don't order every lab on every patient every day, and why we don't order a total body scan on everybody, because there are there's studies that show too much testing can also be bad, and uncover things that probably don't mean anything, but they lead to more tests and then more tests, et cetera, et cetera. So it's empowering to be able to order your own labs, and I think that can be great when on an occasion when there's something that you really want to order and you have a stubborn provider who says, oh, you don't need it, and you're willing to pay $40 out of pocket to get it for your sense of peace. But I think we have to have a trusting relationship with our healthcare provider, have an open discussion, and see what are the best ones to get.
Yeah. Well, I like what you said, Dr. Kim, about somebody should go over the results with you, because a lot of times, especially if you've just gotten them yourselves, or a lot of times, a lot of the medical systems, it's like a My Health, it's an online thing. So you get a test and it's put in there, and there's nobody to tell you what it means, because you may not have another appointment.
Yeah.
Yeah. So what are the top three or top five blood tests that everyone should get? Or are there special ones that people that are vegan or plant-based should always get? Like I hear a lot about, like, oh, you got to test your omega-3 fatty acids because you're not eating nuts every day, things like that.
Anthony, did you want to say something before we got into that? Oh, you're still muted.
Yeah, and I can even take a stab at that one. I was just gonna build a little bit on the what we had said about the numbers, but maybe I can start with you guys can quiz me. I'll answer AJ's question and you guys can tell me where I went wrong and add things. But I do think that there are some simple markers that really help patients to understand a lot. And this was not a blood test, but your blood pressure.
Mhm.
Certainly your cholesterol, as we've already discussed. Blood glucose, A1C, which is also a derivative of your blood glucose, and then vitamin B12, vitamin D, and the omegas. And from what I've learned over time and having conversations with so many incredible doctors, is that's kind of like that's kind of a strong base, and that's a good starting point for getting some indication of the current state of health. Is anything missing from those?
I would add the chemistry, a general chemistry to check your kidney and your liver function, because you don't know if you're starting to have liver issues or kidney issues. And that's kind of important, whether you're plant-based or not.
Yeah. I think AJ asked specifically about for people who are eating plant-based or vegan. I think, yeah, B12 is a big one, but even omnivores can have low B12. But certainly people who are completely plant-based or completely vegan do need to be supplementing with B12. And so you do need to know your value. Um, the I think I think most of those have good scientific evidence. I think the vitamin D and the omega 3 and 6 ratios are the most controversial of the ones that you listed, Anthony. I think they probably um, uh, omega-3 testing probably has the least amount of solid evidence behind it, and but it's interesting, and it's definitely worthwhile checking in some folks after conversation with your provider. Um, the the vitamin D is very interesting because we do have a lot of data about vitamin D testing. And what's fascinating about it is that we know that people with low vitamin D not only have the risk for bone disease, but are associated with all sorts of other conditions, cancers and premature death. And so we know that there's something really important about it, but but almost every time that we do big studies to look at, well, if you test a bunch of people and you find those people with low vitamin D and then you put them on supplementation, it doesn't actually seem to improve things. And so the way I use it personally, based on what I know of the evidence, is that it's a marker for if you are low on vitamin D, it may be a marker that you need to be outside and active more. Because it might be more than just the hormone, the vitamin D itself, but all the myriad of things that we benefit from being outside and active. And so I think maybe it's the Endocrine Society, but it says that maybe check it once in people who are at risk for having low vitamin D, but it's probably not something that you should be checking every 3 months. But anyway, that's how I use it. I'd be interested to see what Kim thinks as well.
I actually agree completely. I think that low vitamin D may be a marker of low infrared exposure, which means you're not out enough. And there's some research on infrared being really important for health, and getting out into nature is so important. So that's one of the things I was thinking of. It's interesting. You need to individualize this. Like, for example, if you've had a stomach reducing procedure of any kind for weight, then there are more tests that I would do. But that is things that I would do specifically with a physician's input in mind. So yeah, I think we've covered everything. Again, iodine, maybe if somebody has thyroid issues and is plant-based, to make sure they're getting that, because that's important. If they're fatigued, CBC and ferritin might be important. And those are the things that I would basically do. There are other tests like zinc and selenium and other tests that you can do specifically, but I really rarely find that's an issue.
You mentioned B12, and I'm not going to say the person's name, but there's a person on social media that's saying we don't need B12. That's kind of dangerous, isn't it? Doesn't everybody need B12, whether they're vegan or not, or at least test what theirs is?
I believe we all need B12.
Yes.
And yes, I've heard some of the chatter about like sort of social media influencers who are saying stop taking your B12, you don't need to take it. But
And they're
I
not
think,
doctors, by the way. They
yeah,
have
I think,
no medical degree whatsoever.
yeah, I
That's
think
one
all the medical evidence that I'm aware of is that B12 is quite important.
that's one I would test and not guess. And what's interesting is we can store B12 for several years. So you may not
Yeah.
need it for a little while and not get in trouble, but then you get in trouble. And you don't
Yeah.
want to get in trouble with B12. That's an issue.
Yeah.
Yeah,
I love what you just said, test and not guess. What happens if you're deficient in B12, and how quickly can it happen, and is it reversible?
Good question. Sometimes not. It's you can have neurologic issues with low B12, and that's a real problem. And I've seen anywhere from a couple of months to a couple of years of storage ability for B12. And then there's also people who don't absorb B12 correctly. So that's more complicated. Even if they're taking it by pill or by liquid in their mouth or supplementing in some way, they may need to have, IV, but that's rarer.
Does it matter? Because I hear that, this is the thing, but I think there's so much confusion in the plant-based world because one doctor says it has to be this type of B12 and one says this. The most important thing is, I think, is to take it rather than argue about which one is better.
That's
Yeah.
correct. Go
And,
ahead.
Yeah.
and Dr. Kim or Dr. Pierce, the things that I'm aware of for B12, how people can start to actually know without a blood test. Like I've heard scary stories of people becoming, is it like tingling or numbness in your cheeks or your face? And then where does it go when your B12 deficiency goes beyond that? What are other things? Is it am I correct in thinking it's numbness in your fingers, or is that something else?
Yeah, it can be both peripheral, but also central. I've seen patients in the who had to be admitted to the hospital who had lesions on their MRI of their brain and spinal cord. So it can be quite serious, not only neurologically, but it can also cause an anemia. Um, and so definitely important to know your number on that and not to mess around with it.
Yeah, and it's such an easy one also to supplement. I mean, the supplements are so cheap and it doesn't build up toxicity in your body. If you take too much of it, you just end up urinating it out, as I understand. You just and it's easy to do. And most of what I know about supplementation and testing is really related to raising two kids on a whole food plant-based diet, because I'm a cautious person. And when you're doing anything outside the norm, like we want, the thing that I admire and love about our whole food plant-based community in general is that they're not people who are here to try to strive for average. Like, we're all trying to do better, right? We're all trying to be the best that we can be. And part of that is knowing what's going on. So as I'm raising my kids, I wanted to make sure I wasn't harming them or damaging them in the process. So these are the lab tests that we always tracked with our doctor. And it was not always easy to get our doctors to order these tests, as their pediatrician and things like that. But luckily he was a very helpful doctor with us, and he would help us to tell him the things that he needed to hear in order to fill out the form to order these tests for us. And I'm grateful that they came back always within a reasonable or a healthy range, but there were certainly some opportunities to make improvements in these over the kids. And I'm just glad that we've done that. And it's not to say that everyone should base all of their health experience over the examples that one or two people have, because what we really know is that, like, managing the numbers is not the goal, right? It's really, you're managing the numbers because of what they indicate, and they could indicate future risk and problems that, as you started to say, AJ, that may not be so easily reversed, right? So that's why we measure cholesterol, not so people have a different number or they can go out to their friends and brag about their cholesterol number. It's so that you have the internal knowledge of knowing that you're doing what you can to lower your risk of heart disease. And just like a low cholesterol is not a guarantee that you're not going to have a cardiovascular event, a high cholesterol might not be a guarantee that you will have a cardiovascular event, because we get a lot of people calling us or saying that they're doing everything right, but their cholesterol is still high. And when they call the phone and I answer or Susan answers, I mean, we just have to really just encourage them then to have an appointment, because that one number needs to be taken into context with everything else that's going on in that person. Because someone who's got a very high cholesterol because they eat nothing but saturated fat and animal products and fried foods is very different than someone who has an elevated cholesterol level who eats a very low fat, whole food, vegan, plant-based diet, jam-packed with vegetables and healthy grains and all of this stuff. So that's where the individualization comes on, and realizing that what we're working on is lowering the risk of disease in the future, not just moving these numbers down from our blood test report.
Great, thank you. And speaking of blood tests, we have a question from Dixie. When you're in the Chef AJ and Friends community, your question goes right to the top of the queue. And
VIP.
yeah, exactly. No, but it's true. It's true.
It
And also
is.
we get many of these special people in the private community for our weekly lives together. But Dixie would like to know, what could make cholesterol rise when you don't eat animal products, and how then do you lower cholesterol levels?
Kim, do you mind if I start with this one?
Go for it.
Probably a lot of folks on the call know that we produce our own cholesterol. Our livers make cholesterol. Cholesterol is 100% necessary for life. Our bodies have cholesterol within the cell wall. It's quite important for for existence. But the good news is we don't have to eat any of it. It all is made, all that we need is made by ourselves. And so the reason why most Americans have high cholesterol is from three sources in the diet. Uh, Eating cholesterol, but probably more so eating saturated fat and eating trans fat. And those three sources increase our cholesterol levels in our blood. Um, for folks who do not eat any animal products, then you won't be getting any cholesterol from the diet. So all the cholesterol in your blood you've made yourself. There are some people who genetically just make more cholesterol. There are uh, uh, genetic conditions that run in families called familial hypercholesterolemia, where you might not eat any cholesterol at all, and you might have a value that's 5 times above what it should be. That's one reason why it's important to test, even if you are eating extremely healthily. Yeah, maybe I'll pass the torch to Kim.
I think that's exactly right. Also, it's how much we reabsorb when we're in our system, because if we have when we have cholesterol that our body makes, we dump it through our stool, but sometimes we don't, we reabsorb too much or we don't dump it. And so there are things that a healthy vegan can do, like avoiding saturated fats, trans fats, oils, certain oils, and things like that, extra calories. But they can also have soluble fibers and eat that to help poop out more. There's lots of little different tricks and tips. Dr. Greger's coming out with a new book on that very soon, which will help out a lot of people. But this is a case where also, if you have familial hypercholesterolemia, it is not a failure to take meds when you need them. You want to take the least that you need, and that's what we're here to do, is help that. But if we did everything all naturally, we wouldn't have our teeth because we wouldn't brush our teeth at our age, So, we have to help our bodies a little bit. We live longer than we used to. And so it's not a failure if you need the least, if you need something. Like, for example, a type 1 diabetic needs insulin, but we want you on a physiologic dose, the lowest that you need to help. And thankfully, we have that. We have some medicines that can keep us alive to live a wonderful life. And so I want to make sure that people understand that we are still doctors. We use lifestyle to get you to live as healthy and long as possible and have a wonderful health span, including lifespan, but the health span is important. But we all need a little help sometimes. So
Thank you. Well, you talked about if you do use medicine, you always want to use the least amount for the shortest time possible. But Robbie, who's watching live, says, when should we worry about our LDL cholesterol? It does not seem to budge in spite of following a whole food plant-based diet since 2016. Statins or no statins, it's still around 100 to 120.
So LDL is that cholesterol marker that we follow the closest in general for its association with heart disease. And it's interesting, we have classically over the years, we have it's a moving target for what we recommend as the goal LDL. And what up until recently, what we would say is, well, if you have average risk, try to get that LDL below 100. If you have above average risk, if you have known heart disease, if you have diabetes, you're shooting for an LDL below 70. Kim just mentioned that the book that Dr. Greger just came out with about lowering LDL naturally with food, which is I just got my copy. It's great, and he also has an ebook and an audio book about it, and just did a webinar on it. And he does a good job of breaking things down. And one of the things that one of the main impetus for writing that is that the powers that be, the panels that talk about recommending our LDL numbers what they should be, it seems like all the science is saying that lower is better no matter what. And so trying to bring that that number as low as possible is the way to go. But they also don't recommend that every adult should be on a statin because statins have side effects, right? There's the side effect of taking a pill every day. There's the side effect of increased risk for a small but significant increased risk for diabetes. And then also some people do have either muscle aches or sometimes muscle breakdown, et cetera. So for a patient that tells me I have trouble bringing this down, we really do a deep dive and look at, okay, so if you're eating plant-based, are you also focusing on some of the foods that will bring it down even further? And what I love about Dr. Greger's book is that he puts an emphasis on those foods that have been shown in studies to bring it down by at least 10 points. And so focus on all of those. What can we, most people aren't taking sumac right now. And that was one of them that I learned that can lower it further. So really dialing that in. Plus, sometimes it means a higher dose of the statin that you're on because, I would say most people with an LDL of 130 need to get that down further.
There's other options too. I mean, you want to look at the family history, you want to look at the person themselves. There are things like coronary artery calcification scores or carotid intimal medial thickening, some more testing, which actually looks at the cholesterol in the vessels there. This is where things like the CRP, the inflammatory markers, might come in more detail, weighing the scale of what to do about it. So this is one where it would be best to see a physician who knows both plant-based medicine and how to look at all these and can go through every single part of it with the individual to see what risk-benefit ratio would be. We don't want to worry too all the time. And we do know that when you're plant-based, you tend to have less inflammation, less heart disease, less heart attacks and things like that. Doesn't mean none, but we want to have you do the best you can. So definitely get Dr. Greger's book and then get with a physician who knows and can work individually.
I'll put one more thing in there. I totally agree with what Kim is saying. Something that Dr. Michael Clapper likes to bring up is, someone who is eating a typical American diet with a cholesterol of an LDL cholesterol of 130. How does that person compare to someone who has been eating super healthy and exercising well and not smoking, blah, 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 for the last 50 years, and they have the same LDL cholesterol? And we don't have that study that I'm aware of. And that would be a great study if we get 1,000 people who have, who eat a very healthy whole food plant-based diet and compare cardiac outcomes over the years to other people with matching cholesterol numbers. And the idea is maybe that because of less inflammation, less oxidized cholesterol, et cetera, that the numbers are not equivalent between those two groups. But we can't say that with absolute certainty until we have more data.
Thank you. This is a really good question from Sarah, and I think a lot of people need to know this information, which is, are there certain supplements you should get off before getting blood work so readings can be more accurate? Everybody's muted. I don't know the answer.
I see a lot of thinking going on.
There is one that I'm thinking about for thyroid that affects the thyroid, and I'm blanking on the name.
Isn't isn't it biotin
That's
is
it.
part of a multivitamin and or stuff like that? Yeah, I think that's the one that can affect your thyroid test.
Right. So there are some, honestly, we all believe in the least meds that work, but also the least supplements that work. Because you want to be able to take supplements are just that, they're supplementing. They're not they're not replacing a healthy diet and a healthy lifestyle. So, and they can have issues like a lot of supplements are not third-party tested. They're not monitored. We don't know what's in them. So another one I'm thinking of besides the biotin for the thyroid would be, are you taking red rice yeast? Because that affects cholesterol. But that I would love to talk to the person about specifically. Trying to think if there's other ones.
As I'm listening here, and as you're thinking, Dr. Kim, I mean, I think that it sounds to me like the quick answer to the question is not really. That you just go in for your blood testing as you do normally, and you don't worry about your supplements accidentally pushing something one way or another. I think a follow-up question I would have is, if there is a supplement that's in the if there is something completely out of range, would you be able to pick up on that as a doctor who's reviewing the person's chart? Like I and just to give a little more context for everyone, what I'm thinking is, I know some markers are moving together, right? Like it might be hard to have one thing elevated without another, right? So like I'm sure that as doctors who reviews millions of lab reports, you know kind of what the patterns look like, right? Whether it's something, and then I would assume that these things jump out at you. And if someone was elevated because of something like a supplement that they were doing, do you think that that would poke kind of something abnormal that you might be able to pick up on anyway, if that was the case?
Hmm. Yeah, I mean, it's important to look at the results, not just as individual numbers, but in the patterns. And when something sticks out, you're going to do a little bit deeper dive, and it may be related to something you're taking at the time. I mean, when I think about supplements affecting lab values, I think it might be more likely that you're taking something that has some that's altered with a chemical because the supplement industry isn't well regulated. You might, have a high lead level or something related to, you're taking some supplement that you think is good for your thyroid health, and then unfortunately has, some other substances in it, some other heavy metals or something like that. So that does come up sometimes. I double checked that question about the biotin, and it will falsely lower TSH, so it might make your TSH look low, which when you interpret that, it would make the provider think that maybe you have hyperthyroid, but it doesn't actually affect your thyroid. It just makes it look low on the test. And biotin is something that you might see in your multivitamin, but that would be the only thing. And to tell you the truth, I think rarely does it come up clinically. It's just one of those things that we're aware about. And so if your thyroid test looks off, then I would double, check to see if you're taking something with biotin. But in general, I wouldn't worry about it. I agree with you, Anthony.
Yeah, I
Okay.
agree, Anthony. I like to have people come in to see me and do testing on what they are on, but I have taken people off of vitamins because, I had some people a couple come in with, I don't know, they were taking 50 or 60 vitamins at once. And we went through their list, and half of what they were taking was counteracting what they were taking. So it was so much better for them to get off all of them, restart. They actually felt better and weren't spending $400 a month on that. So, this is one of the subtle things where, again, take the least that you need and at least that works.
Yeah,
And
that's a
I
great
put that
reminder.
into, I'm sorry. Go ahead, Jeff.
Just briefly, that's a great reminder, Kim, that like the massive benefits that we see for like either longevity or reducing heart disease or cancer risk, that's not supplements, even though the infomercial wants you to think that it's there, this is going to be the one that's going to add 10 years to your life and make you feel like a rock star. the scientific studies really show that what adds to health are not supplements, but lifestyle changes and making sure you have the right vaccines and that you wear a seatbelt and that you don't smoke and things like that.
Yeah.
So here's a question about A1C, and maybe you can explain what that is. Susanna says, what do you medical doctors consider an ideal A1C for both health and longevity? And in A1C, is the lower the better true?
Kim, you want to start?
Sure. So A1C is checking your sugars. It's the average sugars that you've been running for the last 3 months, which is nice because it tells you not just what your sugar is this minute, this time, but the average for the last 3 months. And it's helpful for us to look for diabetes, pre-diabetes, and some insulin resistance. So as far as I know, and Jeff, you can correct me if I'm wrong, lower is better. But I don't worry about it in most people as long as their fasting sugar is good and their A1C is below, is not in the pre-diabetic range of 5.6 and higher, or the diabetic range, which is even higher. So it's a great way to take a look at that. And I forgot, AJ, your question again about it.
Oh, in this case, is lower better, or does it just have to be in the correct range?
This is one where I wouldn't go crazy on. Let's get into the correct range. But if it's 5.3 versus 5.2, I don't care. That's great. They're both excellent ranges.
Yeah, I think yeah, go ahead, Anthony.
Oh, I was going to say, I have a story that I always tell people who call and prospective patients to help them understand the difference in the conversations with the doctor. And I think this is related here. If a patient calls and they're trying to understand, like, what's the value in seeing a doctor who's focused on prevention and reversal versus just the treatment and management of disease. And I always say, for example, if a patient goes to the doctor and their cholesterol is around 185, right? Or it's even 190, right? The most conventional doctors are going to, like, kind of give them a little bit of a high five and tell them that, you know, they're on their way and they don't require medication, because the tool that doctor has doesn't really kick in until cholesterol peaks over 200 or maybe 205 or maybe 210. Then the doctor knows exactly what to do because they've got a tool for that. They can write the script. But what we hear from in the world of optimizing health and wellness and prevention is that the lower cholesterol is better, especially, as you've said several times, Dr. Pierce, you know, especially the LDL, getting it just absolutely as low as it will go. That I explained that when you meet with a doctor who is focused on prevention, they're going to say, look, your cholesterol is 185. You're not in the danger zone right now, but it's inching up. Eventually, if it continues to inch up, you are going to require medication. And the good news is that we can make diet and lifestyle changes to bring that down. And when you bring that down with diet and lifestyle changes, not only are you reducing this one risk factor, but that you're basically making improvements in all the other risk factors as well, right? So relating it to this person's question, you know, we can all kind of get behind the idea of wanting to have a lower cholesterol. And the number that I hear kind of tossed around from different studies and literature is a total cholesterol at around 150 or in that ballpark is pretty good indicator of a very low risk of cardiovascular disease. So I think, you know, what I haven't heard, and what I don't know if either of you can elaborate on, and what you started to talk about, Kim, is getting that A1C down below 5 to 4 into the 4s, or even, you know, like the mid to low 4s. Like, is there any benefit there than being over? And I think it's interesting because we kind of need glucose in our body to run our muscles, right? Like, so it's I would guess, from just a logical, which I know doesn't matter very much, but from just a logical perspective, that we need glucose and that our muscles need that. That's how our energy, that's how our whole body and brain and everything run, right? So I would guess that lower glucose is not always better. You're going to reach a limit where now you're under, right? And I know for people who are over medicated, and they start to make lifestyle changes, when their blood glucose goes too low, that they actually can get faint and dizzy, and they can fall down, and they can have low glucose events. And sometimes those are even more risky or more dangerous in the immediate term than having a higher blood glucose. So So all of that is a long story to say it doesn't sound like it matches up with cholesterol where lower is better. But I don't know if either of you know if there's an ideal target to shoot for like an A1C.
I think what we know is what the American Diabetes Association recommends is to keep your hemoglobin A1C below the pre-diabetic range. And the pre-diabetic range A1C is from 5.7 to 6.4. Diabetes starts 6.5 and higher. And so there does not seem to be any known scientific evidence besides keeping it below 5.7, that 5.2 is any worse than 4.8. This is one of those areas where when you see a number that's less than 5.7, give yourself a pat on the back, say congratulations, and don't stay up all night because it was 5.5 and not 4.2. The yeah, the heart attack risk and other complications, start increasing at about 5.7 and go up from there. And it's important to know that value, right? Because about 50% of Americans have either prediabetes or type 2 diabetes now. And so it's super important to know your number. But less than 5.7 is good.
I think that's very important that you mentioned that, because so many people don't know that and that Anthony mentioned before, blood pressure. People don't know that their blood pressure is high. They don't feel it necessarily. And that you do get damage starting with pre-hypertension, as you do with pre-diabetes. So getting into the non-diabetic, non-pre-diabetes range is absolutely correct. And Anthony, you're correct. Too much, if you come to us as a patient and change your lifestyle radically, your diet, your exercise, et cetera, your stress, you may be on too much blood pressure or diabetes meds and going too low. And that's not good either. So it's really important that you have a physician, if you're on especially meds for diabetes and blood pressure, if you're changing your lifestyle, talk to your doctor, because if you start feeling weak, it may not be the diet. It may be that your meds are too strong at this point, and that can be dangerous.
Thank you. Back to B12. Do you believe that cyanocobalamin contains cyanide and therefore people should avoid it and take methylcobalamin? Or there's a third one, I think, that I can't think of the name of right now.
Uh, Either are fine. Cyanocobalamin or methylcobalamin are fine. Cyanocobalamin tends to be a little less expensive and I think more shelf stable, if I remember correctly. And so buy one from a reputable company that has third-party testing, so that you make sure that you're getting what the label says you're getting, but don't worry about cyanide poisoning from your B12.
Agreed.
Thank you. Ravi, who had the question about the LDL, said he heard that CoQ10 helps statins work better. Is that true?
I think CoQ10 helps people with the side effects of muscle pain when they're taking, if they have that side effect when taking statin. Whether it helps it work better, I'm not so sure, but it certainly can help with some of the side effects.
Great. Here's a great question from a live viewer named Cynthia. And I was going to ask you a similar question, which is what was one small daily habit that has a big impact on long-term health? But she wants to know specifically what diet or lifestyle changes could be incorporated to lower the A1C. She's working on it.
Well, first, great job working on it. That's awesome. So diet, interesting. Timing of eating is very interesting. Mike the Vegan had a really interesting video on timing of eating. So eating earlier when you're more insulin sensitive can help. Exercising after you eat makes a huge difference to take down your sugars and regulate them. Keeping your stress down, which can help your sugars, not just keeping it down, but knowing how to work on stress, like breathing techniques can help take down your sugar. So I think it's great that you're working on it. Every little bit helps, and consistency is really important. Doing something every day rather than, oh, I'm going to do this for 2 weeks and then go off is not the way to do it. It's long-term, consistent, little changes will help you the most. Dr. Peter, Jeff, what do you have to say?
For bringing down A1C naturally, yeah. Yeah, I love all those suggestions. I think a lot of folks on the listening in are hip to the knowledge that while we used to only talk about the sugars and white flours that you're consuming, that a lot about our diabetes is related to what's called insulin resistance, and that's mostly driven by the dietary fats. And so for folks who are eating, say, a 100% carnivore diet, they're like, look, my sugar looks great, but they're developing insulin resistance because of all the extra fat that's being deposited in their cells, messing up their glucose management machinery. And the moment they introduce anything with carbohydrates, even healthy carbohydrates, they're more at risk for seeing their blood sugar levels elevated. So what I tell my patients who have prediabetes, type 2 diabetes, and are trying to get their numbers down, I say, look, yes, it's a good thing that you're avoiding soda and uh, ho-hos and Twinkies and stuff like that. But it's also important to bring down the dietary fat. So skip the animal products as much as you can. Skip the added oils as much as you can. Saute with water, veggie broth, stuff like that, and you will see your numbers getting better quickly, and sometimes so quickly that we better start cutting down your medications because within days to a week you can see massive changes when you start lowering the fat content in your diet, along with getting more sleep and decreasing your stress and all the things that Kim was talking about.
Mm. Here's a question from Barrel Watcher. Can a telehealth doctor order the labs, or can you tell the person what they need to tell their in-person doctor to order?
Anthony, you want to take this?
Sure. Yes, your telehealth doctor can order your labs, and I'll speak firsthand for lifestyle telemedicine. We have national accounts with both Quest and LabCorp, and almost everyone in the United States, lives within a very reasonable commuting distance to a Quest or a LabCorp. And when your doctor orders their labs, the lab order is sent directly into Quest or LabCorp. So you just literally have to schedule your appointment with the lab, go there, get your testing, and your results come right back to the doctor. It actually works exactly the same as it does for an in-person doctor that you would go to see, unless by some chance that doctor has a phlebotomist on staff who's actually doing your blood draw in the office. That would be the one time where it is different, but it's just as convenient. And I will go ahead and say that it's also true with medications. If a patient does require medications, if the dosage change or anything, your lifestyle telemedicine doctor can also order medications for you. And that's also done electronically, exactly the same as it's done from a local, physician. And you just tell the doctor what pharmacy you use. And usually by the time you get off the visit and drive to the pharmacy, it would be there waiting in a bag for you. So we really are trying to offer completely full service medical care as close as possible to the care that people are used to getting in person.
Thank you. That was Barn Owl Watcher. Sorry, I was when I saw all the letters together. There's a question here that I want to ask you from I-58 Farms. What about tracking trends in blood work values to confirm adjustments in plant-based food preparation? And then there was a question I had, like, how can people track their progress without being obsessed with the numbers or perfection? Because if you have a system like where you get your labs delivered to you online, which a lot of people do now, they have this thing called trends where you can click it, and then anytime you've had that test, it kind of shows you a graph. You know what I mean?
Yep, and we even have that in the patient portal as well. If as lab results come in, you get a little icon for a graph, and you click it, and you can see what your data points are over different time periods and how it's tracking in reference to the reference ranges of being too high and too low. I'll let either Dr. Kim or Dr. Pierce talk about, how to track those values without becoming obsessed. And again, being obsessed with just changing the number versus actually the meaning behind the number, which is ultimately risk of some kind of a health complication. Dr. Kim, do you want to go? You look ready.
I'm ready. So that is a very good question. First of all, I ask the person how they're feeling. How's their fatigue? How's their brain function? How's their just general gestalt? That's one way to their pain, their achiness, everything. Because I find people who change to a plant-based diet feel better in so many different ways, even ways that I don't even expect, like they're no longer having bleeding gums. They're, little different little things make them feel a lot better. In terms of tracking the labs, that's again where you want to individualize it and make a decision with your doctor. Do you have something, for example, a thyroid level that we're changing your medication? Then we should recheck pretty quickly in 6 weeks or so. But if you've got a fairly steady, maybe up, down a little bit, which could be lab error and lab inconsistency, or if there's different labs, they mean different things. That's where a doctor can help you read something and say, oh, this is checked in milligrams per deciliter, or this is checked in a different way. So, it gives you peace of mind. I tell a lot of my patients that, you don't need to worry so much. I need to worry. That's my job. Give me that worry, and I'll pay attention to that for you. So, because I don't want people focusing just on numbers necessarily. I want them, stress is not good for the body. And so I want them to let me take that for them and help them make the decision as to how to follow.
Thank you. Rich, who's watching live from Sacramento, wants to know, can working out hard raise your A1C?
So a very strenuous workout sometimes can make sugar go up. In general, exercise brings your blood sugar down, and exercising is an important component of keeping your diabetes in control for folks who have diabetes or pre-diabetes, but also to helping to reverse diabetes by reversing the insulin resistance. And so Kim mentioned earlier postprandial exercise, for example. So when we eat a big meal and then we sit down and watch the game, that's one of the worst things that we can do for our blood sugar, right? Anyone who knows Kim, she does not stay still even when sitting. And it's important to keep moving, particularly after meal. It's much healthier to go for a walk than it is to sit and digest for too much, because it leads to higher blood sugar. One of the major utilizers of our blood sugar is our skeletal muscle. And so when we are going for a walk after a meal, the skeletal muscle brings that glucose out of our blood and uses it to work, right? And that's what we want. And so I encourage all folks who would like to avoid diabetes to exercise. I encourage all folks with diabetes and prediabetes who want to avoid, who want to get their disease under control and who want to avoid some of the complications associated with diabetes, like dementia, strokes, heart attacks, certain cancers, to exercise more, because exercise helps in all of those arenas. Tying this into what we were just talking about not obsessing over lab values, is that someone might have a continuous glucose monitor on and they're doing some, hit or really crazy exercise routine, and they're seeing their sugars going up perhaps, and then they think, oh, I shouldn't work out because I saw my numbers go up once when I was doing that. But really looking at the overall picture, that exercise is good for us, and that will help lower your blood sugar over time.
One thing that I was going to say about this person is you could see the transient elevation of the sugars, but an A1C going up afterwards, that doesn't make sense. So that's where I would have somebody come in and talk to me like, are you doing energy drinks after your workout? Is that raising your sugars? Are you a type 2 diabetic that actually may be becoming type 1.5? Should we be testing a C-peptide and some auto antibodies to make sure that nothing else is going on? So I agree with what Jeff said, transient increase in your sugars after exercise has been seen, especially if it's a a tough race where you're stressed or whatever. But an A1C truly going up and not a lab error needs to be looked at, I think.
Great, thank you. And you mentioned postprandial. Kathy wanted to know what that means. I think I know it means after a meal, right? Yep.
I
Okay.
learned
got
something
it.
today too.
Yeah. Okay. Cool. You're using some doctor talk. So Linda said, when you guys were talking about vitamin D, did you mean D3?
Meaning what we were testing or what we're recommending
I
to
think in
take?
general, sometimes the questions get that my moderator Susanna texts them to me, so there's a lot of them, really a lot. We won't get to all of them, so sometimes I don't see them the second you're talking about that. That's why. But
But
when
I do see when I go to the store, I see vitamin D3, vitamin D2. I see all these different things. Like, I mean, so if I guess if I am interpreting the question is what kind of vitamin D are you typically testing? And then what if you are recommending a vitamin D supplement in addition to the sunshine and getting outdoors, um, are you recommending a specific type, specifically D3 or something else?
So we're usually testing 25 hydroxy vitamin D, and the type of vitamin D that some people take in select situations is vitamin D3, probably better overall than vitamin D2. But again, it's yeah, talking with your provider because D3 may not be necessary for you at all.
Great, thank you. And I think no, I know what you're going to ask when I read this question from Lori. I'm 63, but I've had blood pressure readings of 140 to 145 over 80 since my 20s. Can I just run higher with blood pressure? Could that be a normal blood pressure for me?
Go ahead.
I mean, that's an interesting question. There's not one adult human out there with that has the perfect like 120 over 75, and everybody who varies from that is wrong somehow, right? So there are going to be people who have variances in this. I think most likely people who are living in the 140s, 140, mid 140s systolic, which is the top blood pressure value. Is probably what we would consider abnormal, certainly by the usual definition that's already what we call class 2 hypertension, or excuse me, stage 2 hypertension, where we're above 140 is the top number. Remember that people even in their 20s get high blood pressure, and it is possible if I don't know, I can't give specific medical advice to someone who I don't know their background for, but if I were to guess that most people in their 20s that have a blood pressure of 145, I would say that that is abnormal and that is tied to risk for heart disease and stroke, and that we should work to get it down. If that person, may there be some people out there who are 100% healthy with that blood pressure? I guess theoretically, because, it's on a bell curve, but I would say the majority of those folks are at increased risk for chronic illness, and try to figure out ways to bring it down.
Thank you. Thank you. Well, I mean, I could keep going. There's a lot. I want to respect your time because there's just a lot of questions. So tell me when you want me to ask the last one because I want to make it a good one. Not that the rest of them aren't good.
They've all been good ones.
Yeah, no, I know that is so that is very true. Some of these guys are just too long. They're more like you need to get a consult, like when there's just, lots of numbers and things like that. Ask.
You guys want to take
Did we get to the Sure. Did we get to the question about what's something we can do every day to lower our
risk
to be healthy, to lower our risk for these things?
Well, if not, we can get to it because it's a great question. What's one small daily habit that can have a big impact on long-term health?
I bet you the four of us have four different things to add to that. Who wants to start? Kim, you want to start?
I can't pick one.
I'll go first. I'm
Okay,
not afraid to start.
I want to go with this one too.
Mine is the simplest. Would you like to go first, AJ, or would you like me to go?
Well, I'm changing mine because I'm going to just say have fun because I don't care how good your numbers are. If you're miserable, then who cares if you have a perfect A1C? So my whole life has changed since being diagnosed with cancer. So the number one thing on my list is have fun. Find a way to have fun every single day because you know what? When you're in the coffin, it doesn't matter what your A1C was, does it?
Yeah.
No, you
Nice.
you basically nailed it. I was going to give a something a little bit more practical, but not too much more technical, and just say to eat more vegetables and to walk more.
Mm.
And I feel like if we really want to, like there's so many initiatives going on to change the state of health in the country and the whole entire population. And I feel like those two things would make a significant impact alone if people did nothing else.
Yeah, I agree.
Okay.
And have more fun. That's my new third.
Laugh
Mine
every
mine
day.
are now
I
three
want
Have
you
things.
fun
come.
while you're doing it.
Both of you, two of the three of you, like flirted with comedy, but you never came back. And if stand up is just too daunting for you, just take my improv class. A lot of the plant-based stuff, improv is so easy. You just show up, you make stuff up. You don't have to memorize. You don't have to write. You don't have to perform. There's 3 a week. I don't know where you guys are all week.
Yeah, me neither.
It's tempting. It's tempting. Don't quit on us. We're
Yeah,
thinking
I mean,
about
it's like $20 a class. It's like an hour and a half of your time. You can be on I mean, it's just so fun. I mean, you
Yeah.
could, I would encourage anybody to do it in person if you can find an in-person class, but you've got to laugh every day.
Yes.
Have to laugh
Yes.
every day. I think that's
good
really,
medicine.
really important. I put that on my to-do list every day. It's getting in nature, laughing every day, eating as healthy as possible, and getting a sense of community. The community we have at Lifestyle Telemedicine, the community we have through you, Chef AJ, and your community. It's so important to be a part of positivity every day.
Absolutely.
Right I love all these. So I bet you Kim knows what I'm gonna say. So I think the number one habit we can have for staying healthy is to grow a little food, is to tend a garden, because it's gonna pull you out of your seat, to water and to weed and to pick the slugs off, and it's gonna get you outside in nature and some vitamin D. You're gonna share your produce with your friends and loved ones, and it's going to and at the end, of course, you're going to have something delicious and nutritious to eat.
And you can do that in your house. If you don't have space, you can sprout, you can grow in your house. You'll get all of that fun things, teach your family, be a great example, and have delicious food.
Great. All right. Well, we'll end with one more question because you talked about it a little bit in your answers. How does having a community, especially a supportive community, make it easier for people to build these good habits and stay consistent?
So, willpower, I do not do well with willpower. And so, having a community that I can lean on and learn from and teach and be with has made such a difference on my willpower. Uh, you know, Even in my community where I moved to during COVID, just walking the roads and talking to people, I 11 families in my neighborhood have gone more plant forward, plant based. So when we go to potlucks, it's all awesome because I know I can eat. And it's just, we all want to be accepted. We all want to make things easy and not have to buck the norm so much. So having a community like Chef AJ's or our community, half of the reason I do what I do is because I work with incredible people, both patients and physicians, who encourage me every day to be my best. So surround yourself with that. It's important.
Absolutely. Well, guys, thank you so much, guys. I should really improve my guys. You're not guys. You're what you,
I like guys.
I like guys.
yeah. Well, I always wondered, like I asked this once to Dr. Kim Williams, why they call them a fellow of the American College of
Oh.
Cardiology, because they might be a lady. So how can a lady be a fellow? So I guess I can call you guys. Yeah. All right. Thank you so much. And thanks all of you for watching another episode of Chef AJ and Friends. If you'd like to try the Chef AJ and community, the link's below. You'll get my 21-day jumpstart for free and come back tomorrow a little bit later at 4 p.m. with an actual community member, Susanna, who, with the support of the community, has been able to lose 90 pounds and keep it off. Take care, everybody. And remember, have fun.